Have you ever wondered whether it's safe to have sex during pregnancy? Maybe you're expecting a baby right now, and this question is on your mind. Or maybe your partner brought it up and you simply didn't know what to answer. You're not alone. This is one of the most common questions that pregnant women and their partners ask. And yet, it remains one of the most taboo subjects in the world of prenatal health. Today, on the Dr. Bruno channel, we're going to answer this question honestly, scientifically, and completely. No judgment. No embarrassment. Just the truth, backed by medical evidence, so that you and your partner can make the best decisions for your health and your baby's health during this very special time of your life. We're going to cover everything, from the first trimester all the way to the final weeks of pregnancy. We'll talk about when sex is safe, when it's not, what positions are recommended, how your libido changes throughout pregnancy, what the risks really are, and what your doctor may not have told you yet. So stay with me until the very end of this video, because every single part of it contains important information that could change the way you experience your pregnancy, in a positive way. And before we dive deep into this topic, if this is your first time landing on one of our videos, welcome to the Dr. Bruno community. We are a health channel dedicated to bringing you clear, reliable, and science-based medical information in plain language. If you find value in what we do, please take a second right now to hit that subscribe button and turn on the notification bell so you never miss any of our videos. And if you enjoy this video, don't forget to give it a thumbs up. It only takes 1 second, and it helps us reach more people who need this information. Now, let's get into it. First, let's start with the big question that brought you here today. Is sex during pregnancy safe? The short answer is yes. In most cases, sex during pregnancy is completely safe. But of course, as with everything in medicine, there are nuances, exceptions, and important details you need to know. When a woman is pregnant and has no complications, her healthcare provider will generally tell her that sexual activity is perfectly fine throughout the entire pregnancy. The baby is well protected inside the uterus by the amniotic sac, a strong, fluid-filled membrane, and by the thick muscular walls of the uterus itself. On top of that, the cervix is sealed by a mucus plug that acts as a natural barrier against infection. So the idea that sex could physically hurt the baby is, in the vast majority of cases, simply not true. Now, let's be clear. Pregnancy is not just a physical journey. It's also an emotional one. And sexuality during pregnancy is deeply connected to how a woman feels about her body, her relationship, her fears, and her hopes. That's why today, we're not just going to talk about the biology, we're also going to talk about the emotional and relational side of intimacy during pregnancy, because both matter equally. Let's start at the very beginning, the first trimester. This is weeks 1 through 12. During these early weeks, many women experience nausea, fatigue, breast tenderness, and emotional sensitivity. Naturally, the desire for sex may drop significantly during this period, and that is completely normal. Your body is going through a massive hormonal transformation, producing enormous amounts of progesterone and human chorionic gonadotropin, the famous HCG hormone, and your energy is being directed entirely toward building a new life inside you. For some women, however, the hormonal changes of the first trimester can actually increase their desire for intimacy. Every pregnancy is different. Every woman is different. And there is no right or wrong way to feel during this time. From a medical standpoint, sex during the first trimester is safe as long as the pregnancy is progressing normally. However, some women may experience light spotting after sex during these early weeks. This is usually caused by increased blood flow to the cervix, which becomes more sensitive during pregnancy. In most cases, this spotting is harmless, but it should always be reported to your doctor, just to be sure. One of the biggest fears couples have in the first trimester is miscarriage. Many people wonder, could sex cause a miscarriage? The answer is no. Miscarriages in the first trimester are almost always caused by chromosomal abnormalities in the embryo. They are not caused by sexual activity. Sex does not increase the risk of miscarriage in a healthy, normal pregnancy. This is a very important point, because many couples stop being intimate out of fear, when in reality, there is no medical reason to do so. Now, let's move into the second trimester, weeks 13 through 26. For many women, this is the most comfortable and enjoyable trimester. And that, my friends, brings us to the end of today's video. I truly hope this information has been helpful, reassuring, and empowering for you and your partner. Pregnancy is one of the most beautiful and transformative experiences in human life. And you deserve to experience it with confidence, knowledge, and peace of mind. Here at Dr. Bruno, our mission is simple: to give you the medical information you need in the clearest and most honest way possible, so that you can take the best care of yourself and the people you love. We will never talk down to you, and we will never hide the truth from you. Before I let you go, I want to do one last thing, and that is to connect with every single one of you watching this video from wherever you are in the world. Whether you're in the United States, Canada, France, Cameroon, Nigeria, Senegal, Côte d'Ivoire, Morocco, Algeria, Tunisia, Haiti, Belgium, Switzerland, the Democratic Republic of Congo, Brazil, the United Kingdom, or anywhere else on this beautiful planet, this community is yours. So leave us a comment right now and tell us, what country are you watching from? We read every single comment and we love hearing from you. Your message reminds us why we do this work every day. And if you found value in today's video, please give it a big thumbs up. It costs you nothing and it means everything to us. Share this video with a pregnant woman, a new mother, or a couple who needs this information. Because knowledge saves lives. And if you are not yet subscribed to the Dr. Bruno channel, now is the moment. Click that subscribe button and join our growing community of health-conscious individuals from around the world. When you subscribe, you become more than a viewer. You become a member of the Dr. Bruno family. And as a member of this family, you'll never miss a video that could change your life or the life of someone you love. Thank you so much for watching. Take care of yourself, take care of your health, and I will see you in the next video. This is Dr. Bruno. And remember, your health is your greatest wealth. The nausea often subsides, energy returns, the baby bump is visible but not yet too large. And, interestingly, many women report an increase in sexual desire during this period. Why? Because blood flow to the pelvic region increases significantly during pregnancy, which can make sexual sensations more intense and pleasurable than usual. Some women even experience their first orgasm during this trimester, or find that their orgasms are stronger than before pregnancy. This is also the trimester where couples may need to start thinking about comfort and positioning during sex, as the belly begins to grow. We'll talk more about positions in just a few minutes. Now, before we continue, I want to take a moment to connect with all of you who are watching this video right now. We have viewers joining us from all around the world, and I find that absolutely incredible. Whether you're watching from the United States, France, Canada, Nigeria, Cameroon, Côte d'Ivoire, Morocco, Brazil, the United Kingdom, Senegal, Haiti, Belgium, or anywhere else on this planet, this video was made for you. So right now, I want to ask you something. Drop a comment below and tell us, what country are you watching from? We love hearing from our community, and it always amazes us to see how far this channel reaches. Leave your country in the comments, give this video a thumbs up, and if you haven't subscribed yet, now is the perfect time. Hit that subscribe button and become an official member of the Dr. Bruno community. Your support means the world to us and helps us keep creating content like this, completely free for everyone who needs it. Now, back to our topic. Let's talk about the third trimester, weeks 27 through 40. This is where things get more physically challenging. As the belly grows larger, many of the classic sexual positions become uncomfortable or even impossible. But this does not mean that intimacy has to disappear. It simply means that couples need to adapt and communicate openly about what feels good and what doesn't. During the third trimester, you might also notice that after orgasm, you experience uterine contractions. These are called Braxton Hicks contractions. They are practice contractions that are completely normal and not a sign of labor, unless they become regular, increasingly painful, and rhythmic. If you're ever unsure, always contact your healthcare provider. Let's now talk about sexual positions during pregnancy, because this is a very practical question that many couples have, but often feel embarrassed to ask their doctor. As the pregnancy progresses, lying flat on your back for extended periods is not recommended, especially after the 20th week, because the weight of the uterus can compress a major blood vessel called the vena cava, which can reduce blood flow to both the mother and the baby. So the missionary position, while perfectly fine in early pregnancy, may need to be modified or replaced as the belly grows. Here are some positions that are generally comfortable and safe during pregnancy. The side-lying position, also known as spooning, is one of the most recommended positions during pregnancy, especially in the second and third trimesters. It allows for intimacy without putting any pressure on the abdomen. The woman on top position gives the pregnant woman full control over depth and movement, which can make it more comfortable, especially as the belly grows. The hands and knees position can also be comfortable for many women during pregnancy, as it keeps pressure off the abdomen. The edge of the bed position, where the woman lies on her back at the edge of the bed with her legs supported, can work well in the second trimester, but should be used with caution in the third. The most important thing is communication. Talk to your partner. Tell each other what feels comfortable, what feels good, and what doesn't. Pregnancy is a time to deepen your emotional connection, and that starts with honest, open communication. Let's now talk about oral sex and other forms of sexual activity during pregnancy, because many couples turn to these alternatives when penetrative sex becomes uncomfortable. Oral sex is generally considered safe during pregnancy, but there is one very important exception. Blowing air into the vagina during oral sex is extremely dangerous during pregnancy. It can cause an air embolism, a bubble of air that enters the bloodstream, which can be fatal for both the mother and the baby. This is not a risk to be taken lightly, it is a medical emergency. So while oral sex is otherwise safe during pregnancy, this specific act must absolutely be avoided. As for the use of sex toys during pregnancy, they are generally considered safe as long as they are clean, used gently, and do not cause discomfort. However, if you have any of the contraindications we mentioned earlier, such as placenta previa or preterm labor risk, you should avoid sex toys as well. Anal sex during pregnancy is a topic that requires caution. It is not strictly forbidden in a healthy pregnancy, but it carries higher risks due to the increased sensitivity of rectal tissue during pregnancy, the risk of introducing bacteria from the anal area to the vaginal area, and the discomfort that many women experience. If you're considering anal sex during pregnancy, discuss it with your doctor first. Now let's talk about what happens in the final weeks of pregnancy, the last month specifically. During the final weeks before delivery, many doctors will actually encourage sexual activity. Not for pleasure specifically, but because semen contains prostaglandins, which are hormone-like compounds that can help ripen the cervix and potentially stimulate the onset of labor when the body is ready. This is nature's way of helping the pregnancy come to a natural conclusion at the right time. However, this only applies if the pregnancy has reached full term, 37 weeks or more, and if there are no complications. If your water has broken, you must absolutely not have sex under any circumstances. Also, in the final weeks, many women simply feel too uncomfortable for penetrative sex, and that is perfectly normal and completely valid. Intimacy can take many other forms during this time, and the most important thing is that both partners feel connected, supported, and at peace as they prepare for the arrival of their baby. Let's also quickly address a question many couples have after delivery. When can you resume sexual activity after giving birth? While this is slightly outside today's main topic, it's important enough to mention. Most healthcare providers recommend waiting at least 4 to 6 weeks after delivery before resuming penetrative sexual activity, and in some cases longer, depending on whether there was a vaginal birth or a cesarean section and whether there were any complications such as tearing or episiotomy. Your body needs time to heal. Rushing this process can lead to pain, infection, or complications. Always get clearance from your doctor before resuming sexual activity after giving birth. Now let's bring everything together and summarize the key points of what we've covered today. Sex during pregnancy is safe in the vast majority of healthy, uncomplicated pregnancies. The baby is protected by the amniotic sac, the uterine walls, and the cervical mucus plug. Sex cannot harm the baby in a normal pregnancy. Libido changes throughout pregnancy are normal and vary greatly from woman to woman and from trimester to trimester. Communication between partners is essential. As the belly grows, certain positions become more comfortable than others. Side lying, woman on top, and hands and knees are generally the most recommended positions during the second and third trimesters. There are specific medical conditions, including placenta previa, preterm labor risk, cervical incompetence, ruptured membranes, and active infections, in which sex is not safe and must be avoided. Always follow your doctor's advice. Oral sex is generally safe, with the critical exception that blowing air into the vagina must never be done during pregnancy. Orgasm causes uterine contractions that are generally harmless in a healthy pregnancy, but should be discussed with your doctor in high-risk pregnancies. Emotional intimacy is just as important as physical intimacy during pregnancy. Couples who prioritize communication, empathy, and connection during pregnancy often emerge stronger on the other side. After delivery, wait for your doctor's clearance before resuming sexual activity, typically 4 to 6 weeks. Now let's talk about libido changes during pregnancy, because this is something that affects almost every couple, and it's rarely discussed openly. During pregnancy, a woman's libido can fluctuate dramatically depending on the trimester, her physical symptoms, her emotional state, and her relationship with her partner. As we mentioned earlier, the first trimester often brings fatigue and nausea that can suppress sexual desire. The second trimester may bring a resurgence of desire, and the third trimester may again see a decrease in libido due to physical discomfort, body image concerns, and anxiety about the upcoming birth. For partners, this can sometimes be confusing or even frustrating. It's important for partners to understand that these changes are hormonal and physiological. They are not a reflection of attraction or love. What couples need most during pregnancy is patience, empathy, and flexibility. It's also worth noting that not all intimacy has to be sexual. Cuddling, massage, kissing, and emotional closeness are all forms of intimacy that can help maintain the bond between partners during pregnancy, especially during periods when sexual activity is not comfortable or desired. Now, let's address one of the most important sections of today's video. When is sex not safe during pregnancy? Because yes, there are specific medical situations in which sexual activity is not recommended or even forbidden. There are several medical conditions and situations during pregnancy where your doctor may advise you to avoid sex completely or partially. Let's go through them one by one. Placenta previa. This is a condition where the placenta is positioned low in the uterus, partially or completely covering the cervical opening. In this case, sex is absolutely contraindicated because penetration could trigger serious bleeding that puts both the mother and the baby at risk. Preterm labor risk. If a woman has a history of preterm labor or is currently showing signs of early labor, her doctor will likely advise her to avoid sex because orgasm can trigger uterine contractions that could initiate labor too early. Cervical incompetence. Also known as cervical insufficiency. This is a condition where the cervix is abnormally weak and may begin to dilate too early. Sex is usually restricted in this case to avoid putting any additional pressure on the cervix. Premature rupture of membranes. If the amniotic sac has ruptured before labor begins, sex is strictly forbidden because the baby is now exposed to the risk of infection with no protective barrier remaining. Multiple pregnancy. Women carrying twins, triplets, or more may be advised to avoid sex during certain parts of their pregnancy, especially if there are signs of early labor or other complications. Active infections. If either partner has an active sexually transmitted infection, sex should be avoided entirely, as many STIs can be transmitted to the baby during pregnancy and can cause serious complications. If you are in any of these situations, please follow your doctor's advice strictly. Your health and your baby's health come first. Always. Now let's talk about something that is often overlooked in conversations about sex during pregnancy: the emotional and psychological dimension. Pregnancy changes a woman's relationship with her own body. As the belly grows, as stretch marks appear, as weight increases, many women begin to feel less attractive or less desirable. This can have a profound effect on their self-confidence and their willingness to be intimate with their partner. Partners need to understand this deeply. The most powerful thing a partner can do during pregnancy is to make the pregnant woman feel seen, loved, and desired, not despite her changing body, but because of it. Pregnancy is one of the most powerful things a human body can do. It deserves to be celebrated. At the same time, some partners may have their own fears and hesitations about sex during pregnancy. Some men, for example, worry about hurting the baby or feel uncomfortable with the physical changes of pregnancy. These feelings are valid and should be discussed openly, without judgment. Couples who communicate well during pregnancy often report that their emotional intimacy deepens significantly, and this becomes a strong foundation for their life as parents. Let's also briefly address the topic of orgasm during pregnancy. As we mentioned earlier, orgasm causes uterine contractions. In a healthy pregnancy, these contractions are short, mild, and harmless. However, in high-risk pregnancies, your doctor may advise you to avoid orgasm entirely, not just penetrative sex, to minimize the risk of triggering preterm labor.